Good morning, everyone. We are back with our AM MedTalk episode. This is our third Sunday where I am going to be joining you with a special guest, and we are going to have some great discussions that could only help you either up your practice, look into some new treatment options, approach, work on your patient approach, and a lot of other things. So today I have Dr. Akansha Singh Cornuit joining me. I can see she's already in the live, so let me add her in first and we can then continue our discussions. I have just accepted your invitation. I'm also sending you one to join in, so if you could just accept that and join into the live. And yes, like I always keep saying this, I hope you all have grabbed your edition of the Aesthetic Medicine India magazine, the digital edition. Do not forget to get the copy. Our recent issue features Dr. Akansha. She's made it to the cover of the magazine, and we featured five, what do you say, like the young visionaries, if I have to put it that way, who are making great strides in aesthetic medicine. Dr. Akansha, I am sending you an invite again. If you could please accept it and join into the live.
Now I can see you too.
I am unable to see you, Dr. Akansha.
Oh, I'm able to see you though. Am I visible now?
Mm, No. Can you just try putting your video off and on again?
Yeah. Now?
No. I can't see you. Could you just drop off the live and I can add you again?
Yeah.
Yeah, I'll just do that. Hello, everybody. Whoever is saying hi, thank you for joining us for this live, and do continue to stay with us. Dr. Akansha and we are going to definitely have a very interesting conversation today. So, if you are a doctor, this is going to help you approach your patients. And if you are someone who does a lot of aesthetic treatments, this would help you burst a lot of myths that we may have around seeking these treatments. So today what Dr. Akansha and I are going to discuss is patient myth bursting. But interestingly, we are going to do this through a lot of discussing a lot of treatments. Good morning, everybody. Thank you for joining us again. I am going to add Dr. Akansha again. Yes.
Can you see me now?
Uh, uh, I am unable to see you, but yes, everybody watching us, can you all see Dr. Akansha and me? If you all can just let us know in the comment. Dr. Akansha, can you see me?
Yes, I can see you.
Uh, I'm just checking with my team. Just give me a second because I am still unable to see you.
Everyone says they can't see both of us.
Okay,
But
so
I don't know.
having said
Can
that,
you check with the team as well and see
yes.
what they say?
Yes, my team is just responding to me, but yeah, in the meanwhile, once again, I would like to say that Dr. Akansha Singh Cornuit, she is the founder of PromMed Aesthetics from Bangalore, and today she and I have come live to discuss patient myth busting, but we're going to do this a little interestingly. Okay, I have got a go ahead from the team, so we should go ahead with the live. Uh,
Okay, perfect.
Okay, great. So Dr. Akansha and I are going to discuss patient myth busting today, where I am going to touch upon a few myths and have some related questions. And Dr. Akansha, I would look forward to your responses from your experience on them.
Sure. Let's
Yes,
do it. Let's do it.
yes. I just feel sad that I'm not able to see you, but yeah, of course, we both have met virtually. But before we start, Dr. Kansha, thank you so much for joining us in this live
Also,
today.
thank
And I'm
you
glad that
so much
every
for such a lovely introduction. I'm really excited to be here, and it's going to be a fun session.
yes, yes, definitely. For everybody watching the live, use the comment box. If you have any points to highlight, any questions that you experience with your patients, do feel free to put it in the comments, and Dr. Kansha and I would take it up at during the live. So, Dr. Kancha, if you have to look at myths, I'm sure you would have had such experiences where, patients come to you, you recommend something, and they come up with their own doubts, and you would be like, no, 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 that's not true.
Yeah.
How often does this happen?
A lot. I would say 50% of the time. Because most of the information is all consumed either through Google or Instagram these days. And it's obviously misleading. It's either false information or probably it's not right for them. So it's very important that we, direct them to a right direction, to the right track where we give them the right treatment, which is suitable for them and suitable for their shape, face shape.
Right. Okay. So I have put together a few myths, of course, from whatever you and I have discussed or spoken in the last few days. So let's go through them one by one, and I would have some questions added also to them, which could help us give some more information to those watching our live today.
Okay, done.
Okay. So one myth: aesthetic treatments are only for women. On a scale of 1 to 10, with 10 being the highest, how often does this myth come to you? Like 10 means mostly everybody coming to you has this myth that aesthetic treatments are only for women. How would you rate it?
That's not true. I have a lot of male patients who literally do the same treatments as women. And, it's not exclusively for women. As humans, we're all aging and everybody wants to look good. And it's also become a part of their personal grooming, wherein, it helps them with their life, it's a part of their lifestyle. It helps them in their career. It helps them boost their confidence. So all the treatment that's all my women patients are doing, males are also doing, which also includes lip fillers, so Botox, anti-wrinkle injections, all laser treatments, skin rejuvenation treatments, all treatments that all my female patients are doing, male patients are doing as well.
Can you give us an example of a male patient and a similar treatment, probably, which is known to be very women centric?
Lip filler. You'd be surprised how many guys want to fix their lips in terms of not necessarily volumizing the lips, but to improve the symmetry or give hydration.
Nice, nice. Okay, so I'll go to the
And
next
of course,
myth. Uh,
Botox as well, because these days
oh,
everybody's,
yes.
really conscious about all the lines that come on their face. And they're like, Doc, I want to get rid of these lines. It's making me look old in my pictures. So we're like, okay, we got you.
Ah, interesting. Okay, so let's go to our next myth. Results are immediate and permanent. How often is this an expectation for you?
See, so most of the people, oh my God, they think it's like aesthetic treatments are like magic. They do it once and it's going to fix all their life problems or face problems. It doesn't work like that. There are few treatments that will give you short-term results, and there will be few treatments which will give you intermediate, results or even long-term results. So it's important that you discuss that in the beginning itself, so it aligns with their expectations, right? So
Hmm.
only once we are set to start, they know that certain treatments are going to last certain days or weeks or months or years. Then they can it's easier for them to manage the treatment as well.
So, as a dermatologist, it is also very important that you explain this to them and you give them a realistic sense of the longevity and the follow-up
Yeah, yeah.
treatments that, the.
Of course. For example, immediate results. There are certain things which give you immediate results. For example, a filler will give you immediate result. Certain peels will give you immediate results. Then there will be intermediate, which will take, anywhere from weeks to months.
Hmm.
Again, that
Hmm.
includes Botox, fillers, deep peels, microneedling, RF, and there will be the ones that will give you long-term benefits like Sculptra, HIFU, CO2 fraction laser, all of that. So that needs to be discussed prior.
Right. Right. The next myth, if I could say, is that there is a mindset that aesthetic treatments are only for celebrities. So, if you can
That's
tell
not
us
true
that
at
how
all.
common is this in the general population, and what trends have you observed in patient demographics?
Honestly, thanks to social media, everybody wants to look a certain way these days, and they want to look like certain celebrities. They want particular type of lips. They want particular type of face shape. So it's like I said, it's become part of their lifestyle. So everybody wants to look good and presentable. They want to look good for social media. They want to look good for on their vacations, all of that. So I would say these days, pretty much everyone's doing something.
Hmm. Hmm. The next myth is that you can get the same results with over-the-counter products. Can you elaborate while you give your reaction on this myth? Can you also elaborate on the differences between professional treatments and over-the-counter products?
See, professional treatments, of course, the strength of the ingredients that we use is slightly higher, which is not going to be there for over the counter products. And they're all also, even if something stronger, it's not supervised. And there is no regulatory body also, to give that strength over the counter. So the results are also not going to be that great. It's going to be slightly minimal. I would say over the counter products are more for maintenance
Hmm.
than to treat something, because in clinic procedures we are at least able to combine treatments, we are able to customize treatments for patients. Here over the counter products, people are just randomly buying creams, serums, applying on their face for 2 months. Some, and the combinations they are using, they might freak their skin out, and then they go to a dermatologist to fix it. So there's a lot of confusion happening with over the counter products, and these days so many products are there. It is so confusing for so many people. Most of my patients, when they come, they have bottles of serums in their house. They have a separate fridge for all the
Oh my God.
products, and they're using 7 steps, 10 steps, 11-step routine, which is a, of course, not helping them, and it's also not light on their pocket, and of course that's
Right.
going to leave you with disappointment. So it's best that you do very targeted treatments that will at least address what your concern is, of
Hmm.
course under the supervision of a trained professional.
Right. Right. I also see another myth that, I think this applies to us in a lot of things, that once you start, then you depend on it. You can't stop getting the treatment. So, do you see patients even coming with this fear somewhere? And maybe many a times when you recommend a particular treatment or approach, they may refuse or refrain with a fear that, going forward, we would depend on it and it would become a way of life for us. Do you see that kind of a scenario also?
Not really, because I think I counsel my patients enough to, make them understand that these things are a part of maintenance, right? Just like how you work out, you get a haircut, you get your hair colored. If you like it, you continue to do it. You want to maintain, a certain type of skin, a certain look. If you don't wish to maintain that, you can always stop it. There is no addiction. You go to a gym to, get a certain body type, and you like it. You follow a certain diet, you like it, you see the changes, and you maintain it. So there is no addiction as such, but yes, it does help you, boost your confidence and just generally, uh, look good.
Right. I think over here, one very important point that you highlighted is that it's very important to counsel the patients because
Yes,
I think, a lot of, like, recently we have been, as aesthetic medicine India, also talking a lot about concepts like psychodermatology, emodermatology, and
exactly.
I think counseling the patient is
Yeah,
very important.
very important, because They, like I said, some people think these treatments are like magic. They'll do one session of, each treatment and suddenly they look like someone else, which is not true. And it should be made clear from the beginning itself. Otherwise, people will be disappointed.
Right, right. Okay, going to the next myth. You'll need extensive downtime after treatments. So, can you first highlight that how often do you see patients coming up with this concern? And second, if you can discuss the recovery times associated with a couple of aesthetic procedures, which commonly you put your hands on, and how do you advise your patients and manage this downtime?
See, the downtime depends on what kind of treatment they're getting done, right? So, starting from, for example, when we do Botox and filler, you usually end up with a little bit of swelling, little bit of redness, or if max to max, you get bruising, which takes 15-20 days to heal. But I mean, the short healing time would be a chemical peel, I would say, or even like something like a hydrofacial. Intermediate
Hmm.
would be microneedling or RF microneedling. Things that take a little longer to heal would be CO2 fractional laser and sometimes even threads.
Hmm.
So again, you
Hmm.
have to tell them in the beginning so that they can align that with their social commitments, with their, with their work, with their holidays, so that they don't feel that they they're not like, in the dark that, oh, I didn't know it'll take 10 days to heal and now I have this event coming up. So we want to avoid that situation basically.
Right, right. Okay, before I go to the next myth, I'm seeing a common question in the comment box. It's come from Charming Desert Rose and also from Sophie that it's related to scars. So, how do you take care of your acne scars or how do you take out pimple scars? Since I'm seeing the question coming repeatedly, would you like to respond to it, Dr. Akansha?
Yeah, absolutely. See, acne scars are a little difficult to treat, especially with Indian skin. It takes a little longer. So, number one, patience is very important. Compliance is very important. Along with in-clinic procedures, consistency of using the products are very important. Right. So you can, and again, you can't just choose one that you use products and don't do procedures because products will only do so much. So it needs to be combined in a way where you get good results also and much quicker. So in clinic procedures like chemical peels will help, microneedling will help. Skin boosters will help you reduce your scars dramatically. With that, skincare ingredients like azelaic acid, lactic acid, niacinamide, all of these in combination will work wonders for your scars. Only if your acne is subsided. If your acne is not subsided, then first of all, you need to stop your acne from coming. That's a whole different routine altogether.
Right, right. I must say you're getting a lot of compliments on your skin in the comments. And in fact, our viewers are very keen to know what is your skincare routine. But would you
My
like to give
skincare
one
routine
tip
is
before I move to
my
the next
skincare
myth?
routine is very simple. These days, I've literally put a moisturizer and sunscreen. As of now,
Wow.
a little aware of powder, but maybe it's just a pregnancy glow that
Ah,
I'm getting right now. But yeah, I
right.
like see this is also not overnight. I have really taken care of because I also have acne prone skin. I've really taken care of my skin for years, good 7-8 years. It's a result of that now that my skin is looking this way. But yeah, I usually keep it very simple. Here and there, I do peels. Microneedling also helps, but as of now, I'm not doing much because of my pregnancy.
Nice, nice. God bless and wishing you all the very
Thank
best
you.
at that front. Going next, the next myth, you can't do multiple treatments at once. Is it safe to do combined treatments? Do you have your patients asking you these questions often?
Absolutely. I mean, there are certain treatments that you should not mix, but uh, like I said, as long as you're getting a proper, medical professional, so, to do the treatments for you, it should be safe. You're in safe hands. And the treatments, for example, when especially when I do injectables, I combine so many of them. I would combine a peel with a with Botox, with filler, sometimes even skin boosters. You can also combine injectables with a peel. You can also combine microneedling with PRP. So they can of course be combined if it is the right treatment for you and if it's done in the safe environment.
Okay. Dr. Kirtanjali has a question for you. Kirtanjali Jiva, that what is the downtime for IV glutathione and how much sessions are required to show results?
There is no downtime for IV glutathione at all. So first we start with one session a week. So weekly we do one for 3 months. After 3 months, we do maintenance sessions, which could be once in 3 months or once in 6 months. And you can proceed doing your maintenance treatment. But in the beginning, you need to do one treatment a week for next 3 months.
I hope we have got your question answered. And with that, do we also need to maintain IV glutathione? Is there also any maintenance required? Is her
Yes, there
follow-up
is
question.
maintenance with everything. Everything you do, every aesthetic procedure.
We also have a question on, does microdermabrasion help with acne scars?
It does. I would still call it a maintenance procedure than a treatment. There are
Hmm.
better things to do for acne scars, which will be more effective long term than microdermabrasion.
Hmm. Hmm. And with that, I'll go to the next myth. Aesthetic treatments are dangerous. How do you address safety concerns with your patients, and what measures do you take to also ensure a safe treatment environment?
Again, it comes down to who's doing it, so you again, first of all, you have to discuss everything in the initial consultation as well, that okay, if there has to be some redness, swelling, bruising, that and all needs to be discussed so that they are
Hmm.
prepared for what's to come, right?
Hmm.
So number one. Number two, um, they have to do their research as to who they're going to. And I always ask, my patients to look for before and afters that the doctor's work that they have done previously, so that they
Hmm.
get a little bit of confidence as to, okay, this person can do this for my face. Number three, um, have realistic expectations. Again, suddenly you can't expect to look like someone else. So that needs to set in the beginning. Other than
Right.
that, nothing really. I mean, small things like redness, swelling, a risk of bacterial infection. So, of course, we do that in a very safe environment. So, we don't really need to worry about it.
Yeah. Yeah. Next myth is that fillers make you look unnatural. So over here, the key thing is, what techniques do you use to ensure that the filler treatment looks natural, and how important does patient communication become to, in achieving the desired results?
They will not make you look unnatural if it's done rightly. See, the techniques are very important. The type of filler you're using is very important. What kind of filler you're using for what age group of people is also very important. So once all that is set in place, you're good to go. And it's also very important that you don't do filler too frequently also. Okay, you can do maintenance in the beginning, but if you do it too frequently, then you might end up with unnatural look. Or if you do, if it's a wrong filler for your particular face, then it might look unnatural. So again, very important. Everything comes down to who's doing your treatment.
And speaking of botulinum toxin, also I think there is a myth that Botox is only for the older people. So, what age groups are increasingly seeking botulinum toxin treatments, and how do you educate your patients about the benefits of preventive treatments?
So a lot of people, a lot of youngsters are coming, people who are in their early 20s to get Botox treatment done. It, of course, acts as a preventative treatment wherein they don't want to see static wrinkles when they're in their 30s. Static wrinkles are the wrinkles which come when you even when your face is relaxed.
Hmm.
So they don't want that situation to occur. So they start early, and that way you start to look younger. I mean, even in your 30s or 40s, you look still very young and you don't have those static lines. So, number
Hmm.
one, that is for cosmetic reasons. But if you're doing it for different reasons, then it's either migraine, so that also early 20s, late 20s, or 30s, masseter reduction, hyperhidrosis, which is to reduce the underarm sweating. So there are different reasons why people get Botox done, especially when it's in their early 20s.
Hmm. Hmm. And my last myth on my list, at least for today, and you can let me know if I've missed out on any, that lip fillers always look overdone. So, how do you approach lip filler treatments to achieve subtle and natural enhancements? And what factors do you consider while discussing the options with your patients?
See, lip fillers are a bit tricky and they can be complicated if not done by the right person in the right way. And I always tell my patients to start slow because subtlety is the key. You start with little amount, then you build up on it if you'd like to. And big lips don't suit everybody, right? So the doctor also needs to know what kind of lips are going to suit that particular face. One. And number two, uh, the type of filler also is determined in the beginning itself on the basis of what kind of lips you want. Because there are different varieties of filler, wherein, if somebody's like, I want very natural lips, then you use something which is more subtle. And somebody who wants really out there lips, then you use a different product. And of course, the placement of injection as well.
Right, right, right. Okay, Dr. Kansha, thank you so much. I think we've really, through these myths, been not only, like bursted the myths, but also been able to go into details of patient approach, getting the right treatment at the right time for the patient, and also important to counsel them, important to understand what are their concerns and address them. So I think communication is the key first,
It
creating
is.
awareness, giving a lot of information at the beginning of the treatment becomes very important over here.
Yes, that's true.
And I think social media has been playing an excellent role in giving birth to a lot of myths, like promoting a lot of myths as well as debunking them. What do you think?
Yeah. There's like an internal war happening between people who are making these videos, wherein one is putting a myth out there and the other one is debunking it. Then there's someone else who's trying to come up with a different concept. Like it's crazy out there. No wonder all the patients are so confused.
Yes, yes. So what I'll do is before we conclude our live, and of course, the questions can still keep coming into the comments, but I'm quickly going to have a rapid fire with you. I think we have like another 2 minutes, 3 minutes on us. So I have a few questions for
Perfect.
a quick rapid fire where we can get into some more insights. So can we go for it?
Let's do it.
Okay. So let's start. Do you believe aesthetic treatments are becoming more accepted among men?
Yeah.
One word to describe the results from aesthetic treatments?
One word to describe
The
results from
results
aesthetics.
from aesthetic treatments. Yes.
Natural.
Okay.
They want
Now that's
natural.
again, if we go to see the myths, there could be myths around this as well. Don't you agree?
Yeah, I agree. Aesthetic treatments do give you natural results. It is possible.
Yes. Do you think social media has influenced the popularity of aesthetic treatments?
100%.
One word to describe patient regret?
Uh, Patient? I
Regret.
didn't get it.
Regret.
No, can you repeat the whole question?
One word to describe patient regret.
None.
Great. That's what I was even
No.
expecting. The patient should never regret when they undergo this treatment.
Absolutely not. No way.
Yes. Do you recommend combining treatments for better results?
Oh, yes.
One word to describe patient education.
Absolutely, yes. Most important.
Do-
part of the treatment.
Yes, I think it's the first step
The
to
first step to
starting the
anything.
relationship with the
Yeah.
patient. Yes. Do you think the stigma around aesthetic treatments is decreasing?
Yes and no.
Yes, and
Like we
no.
spoke about, like there are such mixed, there's so much mixed information. So yes and no.
Yeah, that's true. But I think it should go more towards yes,
Yes.
right? Like I think even those who give out information of social on social media, any such platforms, public platforms, we need to look at it very positively because
Yeah.
giving positive information or the right information is only going to help the larger community,
Yeah.
to look to feel more confident
That's
and good about themselves
true.
if they want to. One word to describe patient satisfaction.
Very high
Very high. Wow. So that's from your experience. I
from
think your
my
patients are always
side.
very
Yeah.
yes. Do you believe that natural looking results are available with fillers? We've covered this, but still a yes, no.
100%.
The ideal age to start botulinum toxin treatments.
Uh, Um, like I said, it varies from person to person, but maybe late 20s, early 30s.
Okay. Do you think lip fillers can be done subtly?
Yes.
And the last one word to describe the future of aesthetic medicine. Well, you could take a word or you could take a sentence also. That's fine.
It's booming. Let's just say
Yes, it's booming.
that. It's
Absolutely.
booming. Whether it's good or bad, good work, bad work, everything's booming. Everything's just out there.
Yes. Yes, yes. So, aesthetic medicine India, we came to India in 2019. Our parent company is in the UK, and it's been there since 20 years plus in the UK, aesthetic medicine, the magazine, our annual events, everything. And I would totally agree with you when you say it's booming because we have seen, often what's happening in that side of the world. And
Yeah.
over there, the industry is already established at
Yeah,
another
yeah, yeah.
level,
Yeah,
very open,
absolutely.
very vocal, very positive. Everyone goes in for it. And in India, we have actually seen that kind of growth from 2019 till now. Even the fact that if you go on Google in 2019, if we went on Google and we just tried to look for some information, it
Yeah.
wasn't even easily
Yeah.
available. But today, if you
Yeah.
see, the internet is flooded, be it the mainstream media or be it, the niche magazines as well. So
Everything's
yeah,
available
definitely.
even on Instagram. Like most of my patients, they already know about the procedure. So
Yeah.
my consultation has kind of become much easier because it's they already know everything. They just, whether it's gonna suit them or not is up to me for to decide. But what the procedure is about, they already know.
Right. Right, right, right. Great, great. Such a pleasure speaking with you, Dr. Akansha. I
Same
think
here.
it's been a great start to the Sunday for us, at least. I hope it's been worth your time as well.
Absolutely, I had a lot of fun. We should do it again.
Yes, definitely. So thank you so much. And I must say, I see your activities on Instagram and you have been doing a great job.
Thank
Especially,
you so
I
much.
follow the
Same
videos where
here.
you have been sharing celebrity pictures and you describe, you educate on all the treatments that they
Yes,
probably would be visible on the face. And
yes,
I think that's a great effort from your end to keep your patients educated and even
yes,
confident that what a celebrity does is not only limited to a celebrity, even they can do
yeah.
it. We
And
all can be a
also,
celebrity at the end.
and also, it's important for them to know that even celebrities can go wrong. You know,
Yes, yes,
So, because most of the times what happens is people end up comparing themselves to a very great looking celebrity without knowing that they probably had aesthetic treatments done, and they compare themselves with that particular, figure, and uh, expect y- life is not perfect. Not everyone's
yeah,
face is perfect. So
true,
it kind of, makes them feel bad that, oh, this one is perfect. Look at this celebrity, that celebrity. So once they get educated as to everybody gets some help to look a certain way, it makes them little, feel a little better.
Absolutely. And I think we all need to feel the celebrity within us. Like we all need to feel good, confident about ourselves, and there's no stopping. You do the treatments or
Not
don't
at all.
do these treatments. It's important to be happy about yourself, however you look and how you
Absolutely.
are. Yes.
Yes.
So I think with that, once again, thank you so much, Dr. Kansha. Thank you, everybody, for attending our live, coming
Thank
with
you,
your questions.
everyone.
Thank you. Have a great Sunday. And I will catch you all soon with AM Med Talk on the coming Sunday as well. So stay tuned and continue to follow Aesthetic Medicine India on Instagram. Continue to follow Dr. Kansha on Instagram so that you would get a good bulk of information and burst a lot of myths in the times to come, I'm sure.
Absolutely.
Thank you. Thank you,
Okay, see
Doctor.
you. Thank you so
Bye.
much.
Have a good
Bye.
day. Bye.
You too.
Bye.